Alright, so I'm starting a new book. I'll get the 12th edition when I go to my mom's to pick it up. But it's Emergency Care and Transportation of the Sick and Injured. And starts on chapter 2. So section 1, chapter 2, Workforce Safety and Wellness. Although stressful situations may test your limits, you must focus on patient care while ensuring a safe and secure scene. Utilize the help of others, including your partner, police, a supervisor, other additional personnel, or even bystanders to help manage crisis situations. Stay calm while allowing patients to express their feelings. You may be inclined to express your personal opinion, but it is your duty to remain professional and focused on patient care. There are many methods of handling stress. Some are positive and healthy, others are harmful and destructive. Some estimates indicate Americans consume more than 10,000 tons of aspirin per year, more than 27 tons per day, and doctors in the United States prescribe to their patients muscle relaxants, tranquilizers, and sedatives more than 90 million times per year. Although these medications have legitimate uses, they do nothing to combat stress that may cause the medical problems described previously. The term stress management refers to the tactics that have been shown to alleviate or eliminate stress reactions. These strategies may involve changing a few habits, changing your attitude, and perseverance. A clue to the management of stress comes from the fact that it is not the event itself, but the individual's reaction to it that determines how much it will strain the body's resources. Words of wisdom. An overabundance of stress must concern you. If your gut feeling is that things are out of balance, you may be right. The following sections provide some suggestions for how to prevent the effects of stress from adversely affecting you. Nutrition. Your body's three sources of fuel, carbohydrates, fat, and protein, are consumed in increased quantities during stress, particularly if physical activity is involved. The quickest source of energy is glucose, taken from stored glycogen in the liver. However, this supply will last less than a day. Protein, drawn primarily from muscle, is a long-term source of fuel. Tissues can use fat for energy. The body also conserves water during periods of stress. To do so, it retains sodium by exchanging and losing potassium from the kidneys. Other nutrients that are susceptible to depletion are the vitamins and minerals that are not stored by the body in substantial quantities. These include water-soluble B and C vitamins and most minerals. Strategies to manage stress. Minimize or eliminate stressors as much as possible. Change partners to avoid a negative or hostile personality. Change work hours. Change the work environment. Cut back on overtime. Check your attitude about the stressor. Talk about your feelings with people that you trust. Seek professional counseling if needed. Do not obsess over frustrating situations that you're unable to change, such as relapsing alcoholics and nursing home transfers, focusing on delivering high-quality care. Try to adopt a more relaxed, philosophical outlook. Expand your social support system beyond your coworkers. Develop friends and interests outside emergency services. Minimize the physical response to stress by using various techniques. Okay, minimize the physical response to stress by using various techniques, including periodic stretching or yoga, slow, deep breathing, regular physical exercise, 150 minutes per week, including cardiovascular effort. Progressive muscle relaxation, meditation, and to limit intake of caffeine, alcohol, and tobacco use. As an EMT, you have little control of what stressors you'll face on any given day. Consequently, stress in one form or another is an unavoidable part of your life. As you would study for a test, dress properly for a day of snow skiing, or train for a sporting event, you should physically prepare your body for stress. Physical conditioning and proper nutrition are the two variables over which you can have absolute control. Muscles will grow and retain protein only with sufficient activity. Bones will not passively accumulate calcium. In response to the physical stress of exercise, bones store calcium and become denser and stronger. Regular, well-balanced meals are essential to provide the nutrients that are necessary to keep your body fueled. Vitamin mineral preparations that provide a balanced mix of all the nutrients may be necessary to supplement a less than perfectly balanced diet. To perform efficiently, you must eat nutritious food. Food is the fuel that makes the body run. The physical exertion and stress that are a part of your job require a high energy output. If you do not have a ready source of fuel, your performance may be less than satisfactory. This can be dangerous for you, your partner, and your patient. Therefore, it is important for you to learn about and follow the guidelines of good nutrition. In general, you should limit your consumption of sugar, fats, sodium, and alcohol. Candy and soft drinks contain sugar. These foods are quickly absorbed and converted to fuel by the body. But simple sugars also stimulate the body's production of insulin, which reduces blood glucose levels. For some people, eating lots of sugar can actually result in lower energy levels. Complex carbohydrates rank next to the simple sugars in their ability to produce energy. Complex carbohydrates such as pasta, rice, and vegetables are among the safest, most reliable sources for long-term energy production. However, some carbohydrates take hours to be converted into usable body fuel. Fats are also easily converted to energy, but eating too much fat can lead to obesity, cardiac disease, and other long-term health problems. The protein in meat, fish, chicken, beans, and cheese take several hours to convert to energy. Consumption of fat should be limited to 10% of calories and should focus on monounsaturated and polyunsaturated fats while avoiding saturated fats or trans fats. It is also important to limit cholesterol intake and sodium intake. Carry an individual supply of high energy food to help maintain your energy levels. Eat several small meals throughout the day to keep your energy resources at constant high levels. However, remember, overeating may reduce your physical and mental performance. After a large meal, the blood that is needed for the digestive process is not available for other activities. You must also maintain an adequate fluid intake. Hydration is important for proper functioning. Fluids can be easily replenished by drinking any non-alcoholic, caffeine-free fluid. Water is generally the best fluid available because the body absorbs it faster than any other fluid. Avoid fluids that contain high levels of sugar. These can actually slow the rate of fluid absorption by the body and cause abdominal discomfort. One indication of adequate hydration is frequent urination. Infrequent urination, or urine that has a deep yellow color, indicates dehydration. Right, fruits. The USDA's My Plate icon emphasizes healthy portions of vegetables, fruits, grains, protein, and dairy. Okay, regular exercise. Okay, exercise and relaxation. Regular exercise will enhance the benefits of maintaining good nutrition and adequate hydration. When you are in good physical condition, you can handle job stress more easily. Regular exercise will increase your strength and endurance. To maintain good health, you should engage in at least 30 minutes of physical activity at least 5 days per week. Exercise should be moderate or vigorous and have good health benefits. In other words, you should break a sweat. You may also wish to practice relaxation techniques, meditation, and visual imagery. Your exercise routine should involve aspects of cardiovascular endurance, muscular strength building, and muscle flexibility. Endurance will ensure your cardiovascular system is able to provide your muscles and brain with needed oxygen. Strength and flexibility strength and flexibility building ensures the body is able to handle the requirements that you'll be that you will place on it by lifting patients, performing cardiopulmonary resuscitation, CPR, and moving heavy equipment. Remember, if you do not use it, you will lose it. Plan activities ahead of time and use strategies that make your sessions convenient. Is there a gym or exercise facility near your home or in your route to work? Is there a walking path or a football stadium with a running track accessible? So maintain adequate fluid intake by drinking plenty of water, other non-alcoholic caffeine-free fluids. A regular program of exercise will increase strength and endurance. Safe lifting practices. We've already discussed the physical requirements of being an EMT. Lifting 125 pounds can be difficult if you do not exercise regularly. Lifting is one of the things that you will do often, so safe lifting techniques are critical to your health and well-being. Back injuries are a common reason for on-the-job injuries within EMS. Chapter 8, Lifting and Moving Patients, discusses lifting and moving in depth. For your health and well-being, remember these tips. Pre-plan the move, bend your legs, not your waist. Keep the weight close to your body, lift straight up, using your legs, not your back. Sleep. Good productive sleep is as important as eating well and exercise in the maintenance of good health. Sleep should be regular and uninterrupted. The number of hours is not nearly as important as the quality of sleep. Unfortunately, you may not have the luxury of sleeping through the night. In lieu of a full night of sleep, cumulative sleep hours are very important, so taking short naps may help. The signs that your sleep pattern is ineffective is you fall asleep within seconds of lying down, you find yourself routinely fatigued within an hour or so after an EMS call. The excitement is over and now your adrenaline rush crashes. You're unable to make it through the entire day without severe fatigue. You're unable to concentrate on repetitive tasks such as driving or completing paperwork. Actions you can take to improve your sleep include limiting your caffeine and alcohol intake and tobacco use. These agents have stimulating effects that can interrupt sleep. Since alcohol is both a stimulant and a depressant, routine or excessive use of alcohol can change sleep patterns, preventing deep sleep from occurring. Try to create as consistent a sleep cycle as possible. This may require naps. Many EMS providers are able to change your sleep pattern into several sleep episodes throughout the day. If you're unable to get 8 straight hours of sleep, 3 sleep episodes of 2 to 3 hours each can provide similar effects. Each sleep episode needs to be more than an hour in length to allow for deep sleep. Finally, do not forget the effects of exercise and sleep. Routine exercise will promote the needed fatigue to slip into restful sleep. Disease prevention. Besides sleep, diet, exercise, hydration, and all the other things that make up a healthy lifestyle, you need to be aware of your hereditary factors. Consider what you might know about your immediate families and your ancestors' health. Alzheimer's disease, chemical addiction, cancer, cardiac illness, hypertension, migraines, mental illness, and stroke all feature prominent hereditary factors. The most common of all hereditary factors are heart disease and cancer. Share this information with your personal physician. Your physician is bound by the same oath of confidentiality that you are. Work with him or her to set up a schedule for health assessments, building them into your routine physical checkups. Your physician should be your ally in screening you for these diseases and in assessing your lifestyle as well as your hereditary factors. Knowing your hereditary factors will help you adjust your lifestyle to help prevent disease. For example, if you have a history of diabetes in your family, exercise and diet are critical to your well-being. Maintaining a healthy weight and a consistent exercise routine will help minimize your risk of this disease developing. Smoking and tobacco. If you don't already smoke, please don't start. If you do, please stop. Not only does this habit fly in the face of everything that EMS stands for, it also produces many of the horrible cardiovascular and lung disasters that you will confront during your career. In addition, it sets an awful example for the public, especially the people who have breathing disorders such as asthma, and it makes you look and smell like anything but a professional caregiver. Are you a smoker who's trying to quit? Several strategies can help you. First, try to cultivate a relationship with a mentor who was once truly addicted to tobacco, but who has successfully quit smoking. Use that person as a support and draw on his or her advice and encouragement. There are also programs that attack a smoker's psychological dependency. These programs may include instructions and audio that provide ongoing support. Other options include therapy, hypnotism, and acupuncture. Talk to your primary care physician. Your physician should be familiar with more techniques. All of these solutions are cheaper than cigarettes and their associated health risks. While cigarette use among adults has declined from 42% in 1965 to 18% in 2012, cigarettes remain the most common form of tobacco use in the United States. Use of other tobacco products, including smokeless tobacco, chewing tobacco, and snuff, is still common and has actually increased over the past several years. All forms of tobacco are harmful and must be avoided. In recent years, electronic cigarettes, e-cigarettes, have become popular alternative to tobacco cigarettes, also called electronic nicotine delivery systems, ENDS, or personal vaporizers, PVs. These devices simulate smoking tobacco by producing an aerosol made by vaporizing a flavored liquid solution. Though studies indicate that e-cigarettes are less dangerous than their tobacco counterparts, the extent of their danger has not yet been determined. Consequently, these devices should be avoided. Alcohol abuse. Acceptable alcohol consumption is considered to be 1 or 2 drinks per day, 1 for women, 2 for men. Definition of excessive drinking are shown in Table 2.2. In most cases, people who drink excessively are not alcoholics or alcohol dependent. Definitions of excessive drinking: men, 5 or more drinks during a single occasion, 15 or more drinks per week, and women is 4 or more drinks during a single occasion and 8 or more drinks per week. According to the Centers for Disease Control and Prevention, CDC, excessive alcohol use causes approximately 88,000 deaths per year in the United States, with an economic cost of more than $200 billion per year. Approximately 75% of the total cost of alcohol abuse is attributed to binge drinking. Some studies have touted the health benefits related to alcohol, such as improved heart health from drinking red wine. The CDC notes that no one should start drinking or drink more frequently based on potential reported health benefits. While these benefits may exist, increased alcohol use may adversely impact other body systems, including the cardiovascular, hepatic, immune, and central nervous systems. Excessive alcohol use may also increase the risk of various cancers developing, including those of the mouth, throat, breast, esophagus, and liver. Drug use. Both prescription medications and illegal or illicit drugs may be abused or misused. Both are potentially dangerous and may lead to numerous additional health problems. According to the CDC, drug abuse costs the United States more than $190 billion annually in lost work productivity, healthcare, and crime. Illicit drug use is both illegal and unhealthy, typically resulting in a snowball effect of bad outcomes. Many EMS agencies drug test their employees. Those who test positive for illegal drugs face suspension and or dismissal. Needless to say, avoiding all illegal drugs, take only the drugs prescribed for you personally by a physician, and take them only as directed. If any type of restricted, scheduled, or narcotic drug is prescribed, usually while you are off duty, be sure to notify your employer of the situation. Balancing work, family, and health. As an EMT, you will often be called to assist the sick and injured any time of the day or night. Unfortunately, there is no rhyme or reason to the timing of illness, injury, or inter-facility transfer. Volunteer EMTs may often be called away from family or friends during social activities. Shift workers may be required to be apart from their loved ones for long periods of time. You should never let the job interfere excessively with your own needs. Find a balance between work and family. You owe it to yourself and to your family. It is important to make sure that you have the time that you need to relax with family and friends. Okay. It is also important to realize that coworkers, family, and friends often may not understand the stress caused by responding to EMS calls. As a result of a bad call, you might not feel like going out to a movie or attending a planned family event. In these situations, help from a critical incident stress management team or information sessions conducted by your EMS unit's employee assistance program may assist you in resolving these issues. When possible, rotate your schedule to give yourself time off. If your EMS system allows you to move from station to station, rotate to reduce or vary your call volume. Take vacations to lower stress and improve your physical health so you will be able to better respond the next time you are needed. If at any point you feel the stress of work is more than you can handle, seek help. You may want to discuss your stress informally with your family or coworkers. Help from more experienced team members can be invaluable. You may also wish to get help from peer counselors or other professionals. Seeking help does not make you weak in the eyes of others. Rather, it shows that you are in control of your life. Infectious and communicable diseases. As an EMT, you will be called on to treat and transport patients with a variety of infectious or communicable diseases. An infectious disease is a medical condition caused by the growth and spread of small harmful organisms within the body. A communicable disease is a disease that can be spread from one person or species to another. Immunizations, protective techniques, and simple hand washing can dramatically minimize the healthcare provider's risk of infection. When these protective measures are used, the risk of the healthcare provider contacting a serious disease is negligible. Familiarize yourself with the following terminology related to infectious diseases. A pathogen is a microorganism that is capable of causing disease in a susceptible host. Contamination is the presence of infectious organisms or foreign bodies on or into the objects such as dressings, water, food, needles, wounds, or a patient's body. Exposure is a situation in which a person has had contact with blood, body fluids, tissues, or airborne particles in a manner that may allow disease transmission to occur. Personal protective equipment, PPE, is protective equipment that an individual wears to prevent exposure to a pathogen or hazardous material.
Steady, steady, steady.
I like to read out loud.
What's that?
I like to read out loud.
There you go. Go for it.
Because then I force myself to read the whole thing.
Yeah, that helps me too.
Yeah. Words of wisdom. All communicable diseases are infectious, but not all infectious diseases are easily communicable. For example, hepatitis B is an infectious disease that is communicable. However, salmonella is infectious, but not communicable. Okay, routes of transmission. Whereas all infections result from an abnormal invasion of body spaces and tissues by germs, different germs use different means of attack or mechanisms of transmission. Transmission is the way of an infectious disease. An infectious disease is spread. There are several ways infectious diseases can be transmitted: contact, direct or indirect, airborne, foodborne, and vector-borne, meaning transmitted through insects or parasitic worms. Contact transmission is the movement of an organism from one person to another through physical touch. There are two types of contact transmission: direct and indirect. Direct contact occurs when an organism is moved from one person to another through touching without any intermediary. The scenario of a vehicle crash can help you understand how transmission occurs through direct contact. The driver of the vehicle has hepatitis B and is bleeding from an arm injury. The EMT caring for the patient is not wearing gloves and has a small unnoticed cut on his hand. As he touches the patient, the hepatitis B virus moves from the victim's wound into the EMT's body through the cut on his hand, thus infecting him. This is an example of direct contact where blood is the vehicle. Blood-borne pathogens are microorganisms that are present in human blood that can cause disease in humans. Another example of direct contact is sexual transmission. Patients who are infected with the human immunodeficiency virus HIV can transfer the virus to their partners during sexual intercourse. Yikes. Finger infection from not wearing gloves. Okay. Words of wisdom. Fungi are small plant-like organisms such as yeast. Fungi cause many common conditions such as athlete's foot and jock itch. Protozoa are single-cell animal-like microorganisms. Protozoa cause malaria. Helminths are worms such as roundworms, pinworms, hookworms. These worms are parasites that can infect people and cause serious health problems. Okay, indirect contact involves the spread of infection from the patient with an infection to another person through an inanimate object. The object that transmits the infection is called a fomite. Using the same patient from the example above, the EMT wore gloves. As the EMT was caring for the patient, blood got onto the ambulance stretcher. If the stretcher is not properly cleaned afterward, the virus remains on the stretcher and can be transmitted to someone else days later. Needle sticks are another example of how infection spreads through indirect contact. In this case, the virus moves from the patient to the needle to the healthcare provider. This route of transmission was common many years ago before the advent of safety equipment such as needleless IV systems. Airborne transmission involves spreading an infectious agent through mechanisms such as droplets or dust. The common cold is moved from person to person by coughing and sneezing. Interestingly, when a person sneezes, the moisture from the airway moves forcefully and quickly through a narrow opening. If the moisture droplets are large, they travel short distances and can be involved in direct contact transmission. If the moisture droplets are very small, they are turned into an aerosol and can now float into the air for long distances. Sneezing actually can transmit disease through direct contact and airborne routes. Because of airborne transmission, it is insanitary to use your hands to cover or a cough or a sneeze because the organisms travel into your hands. If you then touch a telephone or a doorknob or a patient, the organisms will travel. Using a tissue when coughing or sneezing is better for controlling the spread of organisms, but you then have a piece of paper full of organisms. One of the best techniques is to avoid contaminating your hands is to cough or sneeze into your arm. Since you do not touch objects with your inner arms, the risk of moving organisms to an object or a person is reduced. The organisms are trapped in the fabric and will eventually die. Foodborne transmission involves the contamination of food or water with an organism that can cause disease. When food is prepared, it is important to ensure raw meats do not come in contact with other foods to prevent spread of bacteria. It is also important that food is prepared and stored properly at all times to minimize the possibility of illness. Proper cleaning of food preparation services before and after use also helps to decrease the likelihood of transmitting foodborne bacteria. Vector-borne transmission involves the spread of infection by animals or insects that carry an organism from one person or place to another. The Black Death in Europe and Asia in the Middle Ages killed more than 25 million people. The bacterial disease was caused by infected fleas that live on rats. As the rats moved, so did their fleas, carrying the bubonic plague. Other vector-borne diseases include rabies and Lyme's disease. Risk reduction and prevention for infectious and communicable diseases. Standard precautions. The Occupational Safety and Health Administration develops and publishes guidelines concerning reducing hazards in the workplace. It is also responsible for enforcing these guidelines. OSHA requires all EMTs to be trained in handling bloodborne pathogens and in approaching the patient who may have an infectious or communicable disease. Training must be provided for issues including blood and body fluid precautions, airborne precautions, and contamination precautions. Because healthcare workers are exposed to so many different kinds of infections, the Centers for Disease and Control Prevention developed a set of standard precautions for healthcare workers to use in treating patients. Standard precautions that are protective measures designed to prevent healthcare workers from coming into contact with objects, blood, body fluids, and other potential risks that could lead to exposure to germs. The CDC recommendation from 2007 is to assume that every person is potentially infected or can spread an organism that can be transmitted in the healthcare setting. Therefore, you must apply infection control procedures to reduce infection in patients and healthcare personnel. So, Table 2.3 summarizes the CDC recommendations. You must also notify your designated officer if you are exposed. Okay, standard precautions for care of all patients in all healthcare settings, Centers for Disease Control Prevention. Component: hand hygiene. After touching blood, body fluids, secretions, excretions, or contaminated items. Immediately after removing gloves and between patient contacts. Personal protective equipment, PPE, gloves for touching blood, body fluids, secretions, excretions, or contaminated items for touching mucous membranes and non-intact skin. Gown during procedures and patient care activities when contact of the EMT's clothing exposed skin to blood, body fluids, secretions, excretions, or contaminated items is anticipated. Mask, eye protection, face shield. During procedures and patient care activities likely to generate splashes or sprays of blood, body fluids, secretions, or excretions, excluding suctioning. Examples include suctioning or endotracheal intubation. That is true. Patient care environment. Soiled patient care equipment. Wear gloves. Handle in a manner that prevents transfer of microorganisms to others and the environment. Hand hygiene. Environmental controls. Have procedures for the routine care, cleaning, and disinfection of environmental surfaces. Special attention to frequently touched surfaces within the ambulance. Handrails, seats, cabinets, and doors. Textiles and laundry. Handle in a manner that prevents transfer of microorganisms to others and the environment. Needles and other sharp objects. Do not recap, bend, break, or hand manipulate used needles. Use safety features when available. Needless IV systems, and place sharps in puncture-resistant containers. Special circumstances. Patient resuscitation. Use mouthpiece, resuscitation bag, or other ventilation devices to prevent contact with mouth and oral secretions. Respiratory hygiene, cough etiquette. Instruct symptomatic patients to cover mouth, nose when sneezing or coughing. Use tissues and dispose in no-touch receptacle. Perform hand hygiene after touching tissues. Place surgical mask on patient or provider. If mask cannot be used, maintain special separation more than 3 feet if possible. Proper hand hygiene. Proper hand washing is the simplest yet most effective way to control disease transmission. You should always wash your hands before and after contact with patient, even if you wear gloves. The longer the germs remain with you, the greater the chance they'll get through your barriers. Any breaks in the skin, such as tiny cuts and abrasions, are potentially access points for pathogens. Although soap and water are not protective in all cases, in certain cases, they provide excellent protection against further transmission from your skin to others. When washing hands, rub your hands together for at least 20 seconds to work up a lather. Pay particular attention to your fingernails, between fingers and back of hands. Dry your hands off completely. Okay, so rinse your hands using warm water. If running water is not available, you may use waterless hand washing substitutes. These solutions can kill many potential bacterial infections. If you use a waterless substitute in the field, make sure you wash your hands using soap and water at the hospital. Finally, dry your hands with a paper towel and use the paper towel to turn off the faucet. Gloves. Gloves and eye protection are the minimum standard for all patient care if there is any possibility for exposure to blood or body fluids. Vinyl, nitrile, and latex gloves provide, nitrile and latex gloves provide adequate protection. Your department may prefer one type of glove over the other. You may have the freedom to choose yourself. You should evaluate your situation and choose the glove that works best. Some patients are allergic to latex. If you suspect you're allergic, consult your supervisor for options. Vinyl gloves may be best for situations with minimal patient contact or non-sterile procedures, and nitrile or latex gloves may be best for invasive procedures while sterility is required. Change gloves if they have been exposed to motor oil, gasoline, or any petroleum-based product. Do not use petroleum jelly with latex gloves. Wear double gloves if there is substantial bleeding. You may also wear double gloves if you will be exposed to large volumes of other body fluids. Be sure to change gloves as you move from patient to patient. For cleaning and disinfecting the unit, you should use heavy-duty utility gloves. You should never use lightweight latex or vinyl gloves for cleaning. Removing latex or vinyl gloves requires a methodical technique to avoid contaminating yourself with the materials on the outside of the gloves. Alright. Begin by partially removing one glove, the other hand, first glove. Sorry. Okay. Gloves are the most common type of personal protective equipment. In the EMS rescue operations, you must also protect your hands and wrists from injury. You may wear puncture-proof leather gloves with latex gloves underneath. This combination will allow you to free use of your hands with added protection from blood and body fluids. Remember that soil, latex, and vinyl gloves are considered medical waste and must be properly disposed. Also remember, many patients have life-threatening allergies to latex gloves. Leather gloves must be treated as contaminated material until they can be properly decontaminated. Eye protection and face shields. Eye protection is important in case blood splatters to your eyes. Blood splatters are a significant possibility in most trauma situations and many medical situations. Wearing goggles is your best protection. Providers who wear prescription eyeglasses will also need additional protection for their eyes. Prescription eyeglasses offer little side protection. Contact lenses do not offer any added protection from splashing. Face shields will also provide good eye protection. Yikes. Gowns. Occasionally you may need to wear a gown. The gown provides protection from extensive blood splatter. Gowns may be worn in situations as field delivery of a baby or major trauma. However, wearing a gown may not be practical in many situations. In fact, in some instances, a gown may pose a risk for injury. Your department will likely have a policy regarding gowns. Be sure you know your local policy. There are times when a change of uniform is preferred because trying to clean off contaminants is difficult and sometimes impossible without professional cleaning and disinfection or disposing of the uniform entirely. Masks, respirators, and barrier devices. Wearing masks is a complex issue, especially in light of OSHA and CDC requirements regarding protection from tuberculosis. You should wear a standard surgical mask if blood or body fluid splatter is a possibility. If you suspect a patient has an airborne disease, you should place a surgical mask on the patient. However, if you suspect the patient has tuberculosis, place a surgical mask on the patient and a particulate air respirators such as an N95 mask on yourself. If the patient needs oxygen, place a non-rebreathing mask instead of a surgical mask on the patient and set the oxygen flow rate at 10 to 15 liters per minute. Do not place a particulate respirator on the patient if it is unnecessary and uncomfortable. A simple surgical mask will reduce the risk of transmission of germs from the patient into the air. Use of a particulate respirator should comply with OSHA standards, which state facial hairs such as long sideburns or a mustache will prevent proper fit. Particulate respirators must be fit tested to ensure their efficacy. Although there are no documented cases of disease transmission to rescuers as a result of performing unprotected mouth-to-mouth resuscitation on a patient with an infection, you should use a pocket mask or bag valve mask. Mouth-to-mouth resuscitation is rarely necessary in a work situation. Remember, outside surfaces of these devices are considered contaminated after they've been exposed to the patient. You must make sure gloves, masks, gowns, and all PPE items that have been exposed to infectious processes or blood are properly disposed of according to your local guidelines. If you are stuck by a needle, get blood or body fluids in your eye, or have significant body fluid contact with the patient, immediately report the incident to your supervisor. Proper disposal of sharps. Be careful in handling needles, scalpels, and other sharp items. The spread of HIV and hepatitis in the healthcare setting can usually be traced back to careless handling of sharps. Do not recap, break, or bend needles. Even the most careful providers may expose themselves through an accidental needle stick. Dispose of all sharps items that have been in contact with human secretions in approved closed rigid containers. Employer responsibilities. Your employer cannot guarantee a 100% risk-free environment. The risk of being exposed to communicable disease is a hazard of your job. You have a right to know about diseases that may pose a risk to you. Remember, though, your risk for infection is not high. However, OSHA regulations, especially for private and federal agencies, require all employees be offered a workplace environment that reduces the risk for exposure. Note, in some states that have their own OSHA plans, state and municipal employees must all be covered. In addition to OSHA guidelines, other national guidelines and standards, including those from the CDC and National Fire Protection Agency, NFPA, infection exposure to bloodborne pathogens, Infection Control Standard 1581. In addition to OSHA guidelines, other national guidelines and standards, including those from CDC and National Fire Protection Agency, Infection Control Standard 1581, address reducing the risk of exposure to bloodborne pathogens, disease-causing organisms, and airborne diseases. These agencies set a standard of care for all fire and EMS personnel and apply whether you are a full-time paid employee or a volunteer. It is your responsibility to know your department's infection control plan and use it. Establishing an infection control routine. Infection control should be an important part of your daily routine. Follow the steps in Skill Drill 2 to manage potential exposure situations. So first, en route to the scene, make sure that PPE is out and available. Second, on arrival, make sure the scene is safe to enter. Then perform a rapid scan of the patient, noting whether any blood or body fluids are present. Third, select the proper PPE according to the tasks you are likely to perform. Typically, gloves will be used for all patient contacts. Fourth, change gloves and wash hands between patients. Don PPE as quickly as possible to minimize time spent before initiating care. Remove gloves and other gear after contact with the patient unless you are in the patient compartment. Remember that good hand hygiene is always necessary. Fifth, limit the number of people who are involved in patient care if there are multiple injuries and a substantial amount of blood at the scene. Sixth, if you or your partner is exposed while providing care, try to relieve one another as soon as possible so that you can seek care, including basic first aid such as cleaning and dressing a wound. Notify the designated officer and report the incident. This will also help to maintain confidentiality for both of the patient and you. Okay, components of an infection control plan. Determination of exposure risk. Determines who is at risk for ongoing contact with blood and other body fluids. Creates a list of tasks that pose risk for contact with blood or other body fluids. Includes personal protective equipment, PPE, required by OSHA. Educating and training. Explains why a qualified individual is required to answer questions about communicable diseases and infection control, rather than relying on packaged training materials. Allows an instructor able to train EMTs regarding bloodborne and airborne pathogens such as hepatitis B and C, human immunodeficiency virus, syphilis, and tuberculosis. Ensures the instructor provides appropriate education, which is the best means for dispelling many myths surrounding these issues. Hepatitis B vaccine program. Describes the vaccine offered, its safety and efficacy, record keeping and tracking. Addresses the need for post-vaccine antibody titers to identify patients who do not respond to the initial 3-dose vaccination series. Personal protective equipment. Lists the PPE offered and why it was selected. Lists how much equipment is available and where to obtain additional PPE. States when each type of PPE is to be used for each risk procedure. Cleaning and disinfection practices. Describes how to care for and maintain vehicles and equipment. Identifies where and when cleaning should be performed, how it is to be done, what PPE to use, and what cleaning solution to use. Addresses medical waste collection, storage, and disposal. Tuberculin skin testing and fit testing. Addresses how often employees should undergo skin testing. Addresses how often fit testing should be done to determine proper size of mask to protect EMT from tuberculosis. Addresses all issues dealing with particulate respirator masks. Post-exposure management. Identifies who to notify when an exposure occurs. Forms to be filled out, where to go for treatment and what treatment to give. Compliance monitoring. Addresses how the service or department evaluates employee compliance with each aspect of the plan. Ensures employees understand what they are to do and why it's important. States that non-compliance should be documented and indicates what disciplinary action to take in the face of continued non-compliance. Record keeping. Lists all records to keep, how confidentiality will be maintained, and how, when, and by whom records can be accessed. Okie dokie then. So, be sure to routinely clean the ambulance after each run and on a daily basis. Cleaning is an essential part of the prevention and control of communicable diseases, ensuring removal of surface organisms that may remain in the unit. You should clean your unit as quickly as possible so it can be returned to service. Address the high contact areas, including surfaces that were in direct contact with the patient's blood or body fluids, or surfaces that you touched while caring for your patient after having contact with the patient's blood or body fluids. More information about decontaminating ambulance can be found in Chapter 37 on the transport operations. Whenever possible, cleaning should be done at the hospital. If you clean the unit back at the station, make sure you have a designated area with good ventilation. Any medical waste should be put in a red biohazard bag and disposed of at the hospital whenever possible. Any contaminated equipment that is left with the patient at the hospital should be cleaned by hospital staff or put in a red bag for transport and cleaning at the station. You can use a bleach and water solution, 1 to 10 dilution, to clean the unit. The solution you mix should not have a strong odor of bleach if mixed correctly. A hospital-approved disinfectant that's effective against Mycobacterium tuberculosis can also be used. Use the cleaning solution in a bucket or use a pistol-handled spray container. Do not use alcohol or aerosol spray products to clean the unit. Pay attention to disinfectant directions. Bleach solutions are most disinfectant agents will require air drying to be effective. Do not routinely go back over sprayed areas and dry them. Allow the sprayed surfaces to air dry unless otherwise indicated in the product directions. Remove contaminated linen and place it into an appropriate bag for handling. Each hospital may have a different system for handling contaminated linen. You should learn hospital or department protocols. Any reusable medical equipment should be properly cleaned and sterilized by our department's standard operating procedures. Keep in mind that in hospitals, entire departments are devoted to sterilizing medical instruments. Proper sterilization requires the right tools and the right skills, so always carefully follow your department's procedures. Learn the regulations defining medical waste in your area. The disposal of infectious waste, such as needles, sharps, and heavily soiled dressings, may vary from hospital to hospital and from state to state. Immunity. Even if germs do reach you, you are not necessarily at risk for infection. For example, you may be immune or resistant to those particular germs. Immunity is a major factor in determining which host, the organism, or the individual that is attacking it, that is attacked by the infected agent, become ill from which germs. One way to gain immunity from many diseases today is to be immunized or vaccinated against them. Vaccinations have almost eliminated some childhood diseases such as measles and polio. Another way in which the body becomes immune to disease is to recover from an infection from that germ. Afterward, the body's immune system recognizes and repels that germ while it shows up again. Germ when it shows up again. Once exposed, healthy people will develop lifelong immunity to many common pathogens. For example, a person who contracts and becomes infected with hepatitis A virus may be ill for several weeks, but because immunity will develop, the person will not get the illness again. However, sometimes the immunity is only partial. Partial immunity protects against new infections, but germs that remain in the body from the first illness may still be able to cause the same disease again in the body when the body's stressed or has an impairment in its immune system. For example, tuberculosis can cause mild, unnoticeable infection before the body builds up a partial immunity. If the infection is never treated, the infection may be reactivated when immunity is weakened. However, these people are protected against a new infection from another person. Humans seem unable to mount an effective immune response to some infections, such as HIV, which is an infection with the human immunodeficiency virus that can progress to acquired immunodeficiency syndrome, AIDS. Although hepatitis A immunization is not required by OSHA, you may wish to be vaccinated as a preventative measure. Hepatitis A vaccination is not necessary if you have had hepatitis A in the past. All these vaccines are effective and rarely cause side effects. Remember, germs that cause no symptoms in one person may cause serious illness in another. Okay. Immunity to infectious diseases. Type of immunity, lifelong. Characteristic, the illness will not recur. Example, measles, mumps, polio, rubella, hepatitis A, and hepatitis B. Comments, infection or vaccination provides long-term immunity from getting a new infection. A live vaccine is required only for measles. Partial. The person who has recovered from first infections unlikely to get new infection from another person, but may develop illness from germs that lie dormant from the initial infection, like chickenpox and tuberculosis. Infection provides lifelong immunity to the patient from acquiring a new infection, but the original illness may recur, or it may recur in a different way. In the case of chickenpox, which is caused by the herpes zoster virus, an infection may recur later in the form of shingles. And then no immunity, so none. Exposure confers no protection from reinfection. The infection may wear down the patient's resistance, like gonorrhea, syphilis, human immunodeficiency virus, HIV infection. No vaccine available. Repeated infections are common. For example, there is effective immediate treatment for gonorrhea and germs may be eradicated. However, reinfection is likely if the high-risk practices continue, like unprotected sex. For syphilis, the lack of immunity allows the germs to continue to cause damage within the host. Immunizations. As an EMT, you're at risk for acquiring an infectious or communicable disease. Using basic protective measures can minimize the risk. You are responsible for protecting yourself, so take an active role in achieving that goal. Prevention begins by maintaining your personal health. Annual health examinations should be required for all EMS personnel. A history of all your childhood infectious diseases should be recorded and kept on file. Childhood infectious diseases including chickenpox, mumps, measles, rubella, and whooping cough. You must be immunized against these diseases unless you already have the disease or have been previously vaccinated against it. OSHA has developed requirements for protection from occupational exposure to bloodborne pathogens and needle sticks. Each employer whose employees may reasonably be expected to come in contact with blood or other potentially infectious materials must develop an infectious control plan designed to minimize occupational exposure. As part of these requirements, employers are required to offer the hepatitis B vaccine at no cost to employees with risk of occupational exposure. Employees who decline the vaccine must sign a waiver indicating their refusal to take vaccine and may later decide to take the vaccine at employer's expense. Further, the CDC recommends the following immunizations for healthcare workers: hepatitis B, influenza, measles, mumps, rubella, MMR, varicella, and tetanus, diphtheria, and pertussis. Most of these vaccinations are given to infants and children as part of the routine series of immunizations. It is imperative that you keep all these vaccinations up to date to help protect you as well as your family and patients. Healthcare workers who are routinely exposed to meningitis, often those who work in an institutional setting, should receive 1 dose of meningococcal vaccine. Another vaccine being investigated is Staphylococcus aureus. This vaccine is not currently on the CDC list of recommended vaccines, but may be included soon. You should also have skin tests for tuberculosis before you begin working as an EMT. The purpose of this test is to identify anyone who's been exposed to tuberculosis in the past. Testing should be repeated yearly. If you know you will be transporting a patient who has a communicable disease, you have a definite advantage. This is when information in your health record will be valuable. If you have already had the disease or been vaccinated, you are not at risk. However, you will not always know whether a patient has a communicable disease. Therefore, you should always follow standard precautions if there is a possibility of exposure to blood or body fluids. General post-exposure management.
Who here likes licking pickles as much